I believe that there is going to be a partnership between therapists and professionals, whether they are doctor, nurses, and administrators, and AI.
Hello, everybody. Thanks for turning into the Chris Tech Chat. I am Chris Harrison, founder and CEO of Talentus Global. We're a BPO and top nearshore provider of tech talent and solutions. We've got presence in over 20 countries and 4 delivery centers across Latin America, including Mexico, Colombia, Peru, and Argentina. In today's episode of the Chris Tech Chat, we have Mr. Jay Agarwal, who is a community builder and a serial entrepreneur with over 2 decades of experience. His career has been centered around driving innovation to serve the community and disrupt the way we see the world. Jay is a visionary who leverages his strategic and decisive mind to influence and persuade his team and colleagues to be the best they can be and to build innovative products and solutions that benefit the creative community. Prior to his current role as co-founder of Thrive 360 AI, he has served as an innovator in the financial services, healthcare, education, and consulting services. Jay's also a good friend of us in here for the last 20 plus years or so. So Jay, welcome to the Chris Tech Chat.
Thank you, Chris, for inviting me. I really appreciate it.
Before we dive in, don't forget to subscribe to our YouTube channel and check out the other episodes available on all major platforms. And in today's episode, we're going to talk about something very interesting, which has to do with AI and mental health. If we think about all the buzzwords laying around AI today, right? We've all seen hundreds of tools and engines and others have been using for helping traditional industries and sectors, but not a lot on the healthcare side. I even heard the other day an ex-Big Six consultant who started his own consulting firm claiming that companies should not get rid of other ERPs for anyone. Instead, they should rather look at integration and complementing some AI tools for solving the challenges. Not sure it really applies to all the situation, but that's another angle. So Jay, perhaps we can get started with a bit of background on how the current challenges of mental health in America, what needs to be addressed, and how you see AI aiding this very important issue in America and frankly, across the globe.
Thank you, Chris. So as you know, mental health is a significant challenge across the US. If you think about globally, there are more than 400 million people suffering with mental health illnesses, various illnesses such as anxiety, behavioral health, depression, ADHD, and other types of mental health illnesses. In US, currently, if you think about it, and these numbers speak for themselves, there are 1 in 350 individuals that are seeking mental health help, whether it is with a therapist or a counselor or in schools or colleges across the US. Employers lose about $400 billion annually in terms of employee productivity because of mental health challenges. So we at Thrive 360 AI are looking at this very closely. We have partnered with various researchers and therapists and other organizations throughout US over the last 2 years to bring together a solution that we think is phenomenal and works great. It is scientific based, is therapy based, and it is for the therapists and for those individuals that actually are working with therapists and other counselors throughout their therapy journey.
Jay, your mental health solution, does it apply to anybody? Does it matter the age range? Have you guys identified certain demographic data on who you target audiences for that? Is that something that is there a specific sector, stage, or something that has a higher opportunity to leveraging your solution for helping individuals with mental health? Can you give us a little bit of background on that and where you heading into? Are you in clinical trials right now? What part of the cycle of your product is right now? What state it is right now?
Yes, absolutely. Great question, by the way. So mental health cuts across all geographies and all segments of our population, right? So whether you are a young child or a child in high school or a young adult or working parent, as well as if you are a senior citizen throughout U.S. So mental health cuts across all segments of our population in the U.S. Our solution currently is focused on individuals that are 13 and above, and we have purposely kind of limited that population for 13 and above because we want to make sure that the individuals using our products and services have the knowledge and the know-how to use our solution, right? We are focused on individuals currently. We have two products. One product is a B2C product that you can download through Apple Store and Google Store. It basically will help you through your journey for mental health. But our B2B product is a very powerful product designed to work with therapists and their clients or patients, as well as with counselors across all geographies. And what our B2B product does is actually provide you an insight in terms of what the client is going through as a therapist and how the clients are actually going through your program week over week, month over month. All right. So when you are a therapist, when you are a client going to a therapist, you sit down with the therapist on a weekly basis or every other week basis, and you talk about your concerns, your challenges. The therapist provides you with guidelines and so-called scenarios as to how to deal with certain scenarios in a way that makes your illness better and helps you soften the issue that you have. What happens after the person leaves the therapy room, their life hits them. Their family, their work, their social setting hits them, and the solutions that the therapist has provided them really falls below the so-called priority line for their day-to-day work. And so what happens is they don't get to practice what the therapist has helped them, provided guidance on a regular basis. So when the next time the individual actually goes to the therapist for their visit, guess what has happened? They have not moved the needle in terms of their helping for their illnesses, if you will. So the clock starts all over again, and that is why there's no progress being made. Our solution actually is tailored to the therapist, their way of doing things, their way of helping their clients, and essentially the clients is going to be able to exactly be personalized and treat the solution accordingly. Right, and the therapist will actually see and monitor the progress that the client has made day over day till the time they actually come to the office again.
Jay, I want to ask you something about, obviously you immerse in the healthcare sector. How much involvement or conscience there is on the government side versus the private sector? And the reason why I'm asking this is because I can just see the potential for helping, especially veterans, right? We've got a veteran right here on our podcast, Julio Morales in here. A lot of veterans come back with PTSD. How much awareness, involvement, promotion there is on the government side versus the private sector? You see one sector just advancing much more than the other. What are your thoughts on one versus the other one? Is the government a potential B2B option for you as well? I'll be interested in getting your thoughts on that.
Absolutely. As you rightly pointed out, veterans suffer from PTSD and various forms of PTSD. As they have successfully completed their tour of duty through their areas as well. So it's a huge area of focus for us. We are actually working with several universities and doing some clinical trials around that. We would love to work with Veterans Affairs offices throughout the country and provide a solution because it does do a fantastic job in helping. We have certain test cases and test scenarios where PTSD has been reduced or mitigated to a certain extent. But right now, to answer your question, Chris, the private sector is well ahead of the public sector, if you will, just because they have been more adapting to the technology of artificial intelligence and streamlining how their productivity works, how the individuals, and there is more awareness of, and there is more test cases, like I just mentioned, around anxiety, depression, ADHD, Alzheimer's, even in senior citizens where you have different kinds of illnesses. We see this tool as a continuation of service, continuation of care. This is not a replacement of a therapist. We're actually working with the therapists, with the counselors, with the aid providers, with the social workers that are treating our community day over day.
So from your perspective, this is a supplemental solution to leveraging AI for helping individuals that are a good candidate or they're experiencing some mental health challenges, right? It's not to replace the therapist, your psychologist. It's a way to complement that in a way that makes it more effective. So they ended up doing their homework because, frankly, a lot of us have gone to the psychologist in the past in our lives and there for different reasons and place it there. And they always leave you this homework and you forget to do it. And in your next session, you go back to square one, right? Because you really didn't do it.
Exactly.
So your AI tool through Thrive 360i helps those individuals complete those tasks in a more consistent way. So then the overall treatment has a higher chance of success.
Absolutely.
Is that a fair statement?
100%. We have seen about 90% of improvement in terms of the success rate that a client goes through. Our product is called Cora. It's available on Apple as well as Google Play Store. And it has fantastic gamification and call to actions. So if the therapist says, you got to do your breathing exercise, at least once a day, we will actually send you notifications and reminders and gentle nudges to be able to do those exercises and do those homeworks, if you will, throughout the week, so that it kind of keeps you progressing towards the progress that you need to make based on the prescription that the therapist has provided you.
Yeah. Hey, Jay, and on the other side, do the doctors or the nurses or the nurse practitioners, do they view the status of how the person is doing?
Exactly, Julio. So we have a dashboard, a single pane of glass, if you will, from a therapist perspective or a nurse practitioner perspective, where they can actually see that their clients, their patients are actually doing the work, the homework that they have been prescribed, right? And one of the things that we are doing is through conversation. Our app is 100% conversation. So you don't need to type anything. You don't need to write anything. Our app is able to understand your cognitive behavior, your speech patterns. We collect several biomarkers that are presented to your nurse, to your practitioner, to your psychologist, that tells you where you are in terms of your cognitive state of mind. Where are you in terms of your ADHD or your Alzheimer's or any other biomarkers that we see. We actually we have been able to successfully predict certain types of scenarios, and we have been able to provide that information to the therapist, to the psychologist, to nurse practitioners to be able to kind of have that level of conversation saying, look, I'm having, you're repeating yourself over and over again, for example, or you're using your filler words, if you will, a lot when you construct a sentence, or you're not able to construct the sentence in a coherent manner for whatever reason. Those are all biomarkers that we collect. And we have a scale. We do sentiment analysis. We do mood analysis. We do various types of analysis that are presented to the nurse or the psychologist or the therapist, right? And they can have that meaningful dialogue the next time you come and visit.
So I'm sorry. Good. So there is interaction between the therapist and the patient per se.
Correct. Okay. And if they want to provide some additional tools to their clients and patients through their dashboard, they can actually instruct them so that we can provide them those nudges or reminders to say, hey, breathe slowly, or, have construct when you're talking to Cora, talk in a very comfortable mode, or take a walk. If you have a dog, we can take your walk out for a dog today, because the therapist has pretty much the majority of the information from a patient perspective.
Jay, what does your typical patient look like in terms of how long does it take for him or her to go through this Cora solution augmented with the nurse, the therapist itself? And What does success look like from your perspective, from your lens?
Great question. So in our study, and we are working with University of Houston, we're working with UCLA, CSU, and other universities where what we have observed is it takes somewhere between 10 to 12 weeks to be able to have a success rate. And success rates we have seen anywhere from 70 to 90% improvement for their mental health. We cannot be sure about 100% success because each scenario is different, each human being is different, and their environments are different, right? And so, but what we have been able to do is to show meaningful advancement in their treatment week over week, day over week, month over month.
That's fantastic. I mean, that's such an important thing. And, you know, we look at the success stories in AI in different industries and sectors and places, and there's just tons of tools out there, but it's nice to see how we're tackling in the healthcare side something so important. I've been reading articles about how AI is helping accelerate detection, whether it's cancer or other diseases or diabetes, through the large language models, and they're able to predict better, you know, and faster when someone is so sick about it. But also on the healthcare side, I don't think we've seen a lot of progress being made. And I think your point is right that the private sector, I'm assuming it's taken a much more proactive, a much more aggressive approach towards this, from a funding perspective, from a visibility trial and all that perspective, than the government. And eventually the government will have to step in there as well and take some action, because we got some big problems. And, you know, we mentioned before, you know, our armed forces and there with our individuals coming back from combat with PTSD and so many other, you know, diseases within the healthcare side, within the mental health side. So I think this is great that you're pushing this, and it's something that I think will be meaningful to individuals that undergo this.
Yeah.
What's your vision, Jay? If you have, you know, fast forward 3, 2, 4, 5, 6, 10 years, where do you see this, your product and the technology of AI helping healthcare? What's your vision there in the next, you know, 4, 6, 8, 10 years on it? How far you think this will go? What are your thoughts on that?
Yeah, so you know, our point of view on this is that AI and tools that help the patients and individuals on a day-to-day basis are going to be far-reaching, right? So as I mentioned, right now employers face about $400 billion per year of degradation of service because of mental health issues for their individual. That's a significant amount, right? And not too many employers, while they provide EAP type of services, our application product Cora is going to be making a significant inroads with those employers that actually want to help. Because ultimately helping the employees is going to help the businesses and the stock holders as well. Right? So ultimately it's a win-win-win scenario for everybody. Similarly, as you talked about veterans and their families, right? So it's not just the veterans, but it's their families, right? They also suffer through the same thing that the veterans are going through,
Yes.
right? And so it is super important for us to be there and for those families as well. And Cora is able to support those families and our veterans in a very similar manner. So from 5-10 years from now, I see that AI, the technology, is going to help significantly across all sectors of humanity, in the healthcare sector, right? So whether it is just invention of new tools or invention of new medication or just non-medical services such as Cora have significant impact to the human lives of our citizens.
You think this is a loaded question? You think AI will eventually replace a therapist?
No, we do not think that is the case. I believe that there is going to be a partnership between therapists and professionals, whether they are doctor, nurses, and administrators, and AI. We do not believe that AI is going to be replacing any of those careers or professions for that matter.
Yeah, I agree 100%. Julio, thoughts? Anything else you want to ask Jay as we're approaching?
Yeah, this is impressive. I mean, we're going through the AI boom, as we would say right now, right? And so this is good to see that someone, Jay Agarwal and 360 AI, is after the taking care of people, which is important, right? the health side is starting to activate, AI in a positive way. So it's really good to see. Very impressive.
Which I would assume that AI in healthcare still probably a very small percentage of the pie of all the investment, right? The larger one has to continue to be in fintech, other services and other sectors that are much more active on it than healthcare. But hopefully healthcare will start to catch up over time, because at the end of the day, without a human being, nothing runs, right? Hugo and I were talking about a little bit on my world of recruitment, staffing, and outsourcing, and how tools now are being used on the recruitment process to filter out candidates. And some of these candidates are speaking directly to an AI agent, right? And they're having a conversation back and forth. Incredible, right? But that human touch, at the end of the day, making a final decision has to be made by a human. I agree.
100%. And the fact that we one of the primary reasons why we actually created Quora is through our own personal experiences. Whether it is us as the founders or our family have gone through, several mental health illnesses, right? And we have seen that in our community, where we see individuals that seem perfectly fine, as you meet them and greet them, but they are going through, significant, mental health concerns and issues of their own. And so we took upon ourselves to seriously build this based on research and scientific data, and partnering with pretty prominent researchers and universities across the US to be able to come up with the solution.
Yeah, and I think that's a great approach, partnering with universities. They do a lot of research, obviously, doctors, healthcare facilities within their universities do a lot of research, and something definitely that could be a good test bed for you. And also, universities also have VA offices as well. A lot of institutions today are paying a lot of attention, and that you have another angle in there through the VA offices where you can actually maybe test it out as some of those VAs come back into the mainstream America world, right? They get reincorporated into the system, and I'm sure they go through a lot of challenges and adjustment to be able to adjust back into the normal civilian life, right? Yeah, I mean, I think the stories like this, I agree with Julio, are great. These are disruptive in a positive way for humankind, right? We focus so much on helping financial services and retail and all the other industries, and we tend to leave or not put as much attention into the human side of it. And healthcare, I mean, Julio lives healthcare as well. His wife is in the healthcare sector, the cross between healthcare and tech. So I think he's very sensitive to that, and the fact that he's also a veteran as well.
Yeah.
So I think,
and now recently, my wife's cousin has just got her NP, nurse practitioner license, but in the psych side of the house. So
nice.
Jay, we got to reach out to her to see how.
I would love to have that conversation earlier.
Yeah.
I'll give you one simple example. We were having a conversation with a friend of ours, and his dad just went through a cardiac surgery. One of the things that we learned talking to that cardiologist and that practitioner, if you will, is about 50% of individuals that have a cardiac issue, as simple as a minor clog removal or a stent implant or a bypass, 50% of those patients have depression. This is a known fact. It has been studied widely. Unfortunately, the cardiologist has no tools, and their families, the patients' families, have no tools to help them with anything, right? So one of the things that we are working with is with a very prominent hospital that focuses on cardiologists and cardiac issues, is to understand the behavior of those patients before, during, and after the surgery. And what we have found is that using Quora, they have been able to help those families significant.
Post-op,
even pre-op, because think about it from a family perspective. If the member of the family is going to go through a cardiac surgery, the family is obviously very concerned about that individual, and there's a great amount of depression that already starts setting in pre operations. And then post-operation, there's a significant amount of risk that actually gets inserted into the entire family. And therefore,
Yeah, you just opened up Pandora's box. I mean, the opportunities are endless. Think about critical illnesses, right? And how that affects families, right? For someone who is, critically ill, or he or she eventually is going to die from a disease that has no cure. The mental impact on the whole ecosystem around the family is going to be tremendous. How to deal with that? Nobody
Exactly.
addresses that.
Yeah. And we are doing a study with UCLA for diabetic patients that have food ulcers, right? And there's a significant percentage of those patients actually have amputation, right?
Exactly.
So if you have
I've
food
seen it.
ulcers and so forth, so our app is actually helping them adhere to wearing some kind of a device on the food for helping them go through the, curing the food ulcer, right? And more importantly, making sure our app is actually been able to successfully monitor the adherence of the device, adherence of the medication, if you will, right? And as well as understanding the human psychology, right, of that individual, and helping them kind of mitigate, and that particular region, right? So I think that's a significant. So we're doing various types of studies to kind of understand where our patent pending application can be used in a way that helps multiple different types of individuals, whether it is seniors, whether it is professionals, whether it is individuals that are going through critical illnesses or chronic illnesses, or even pharmacy, where they want to make sure that their patients that are being prescribed these medications are adherent to those type of situations, to these programs, right? So I think it's important for us to kind of look at all of these different areas in multiple different ways, but our primary focus right now is mental health, right? And focusing on how to improve mental health, from a day-to-day perspective.
Absolutely. Jay, as we're approaching the end of our podcast today, thanks for your thoughts and insights. I am sure the audience will appreciate this discussion on the episode. And we certainly look forward to having you in the near future and sharing your advances as well. So once again, Jay and Julio, thanks for being part of the Chris Tech Chat. And folks, please don't forget to follow us on YouTube.
Thank you very much.